So today, I just want to talk a little bit about two topics. I was told that you all had lots of information already about prostate cancer, but as far as these other topics, you wanted to hear a little bit more about them. So the two topics that I'll be looking at this evening will be benign prostatic hyperplasia, or BPH, otherwise known as enlarged prostate. And the second one would be andropause, also known as male menopause. So those are two interesting topics this evening. And the first slide I'm presenting to you here is to remind you, or if you don't really know or understand about the prostate gland, where it is located, and what does it do. So these two pictures here are showing you images of really what is inside your body as men. So you will see one of them showing you the other organs. You can see the bladder, the penis, the testicles, the urethra, which will be the tube that brings the urine from the bladder. You see the bladder, which is that's kind of roundish colored structure, and that's to the top. And just below it is the prostate gland. The other picture is showing you a little clearer so that you can see the bladder on top, and the red looking structure just below is the prostate gland. And the inset, the picture on the inset shows you the relationship between the bladder, the urethra. The bladder is to the top. The urethra is that tube that empties the urine from the bladder to the outside, and surrounding it, looking almost like an apple, is the prostate gland. So the prostate gland lies just below the bladder, and it surrounds the urethra, or the tube that allows urine to come out from the bladder to the outside. So what does the prostate gland do? For some men, they just know that it's a very important organ. And it is, but why is it important? It's important for fertility. In other words, it helps you to be able to have the ability to produce the kind of sperm that will, when joined with the female egg, produce children. So there are some persons who, yes, they have sperm, and sometimes they may tell them that they're shooting blanks because they're not able to have children. So the prostate gland is that organ that is important for making sure that you can produce children. How does it do that? It contributes to the production of semen. That's one. It nourishes the sperm. So in the semen, what makes up the semen has some substances that are going to nourish the sperm and keep them healthy. So in their transition, or their transfer from within the man to within the woman, that sperm has to be healthy. The prostate gland also produces what is known as the prostatic specific antigen, known as PSA. You would have heard of that substance because that's the blood test that they do to check to see some of the conditions in relation to the prostate. So like prostate cancer, they check to see what is the level of the prostatic specific antigen, and that can give some indication that some damages has taken place. It's an enzyme, and that enzyme helps to make the semen thinner and more fluid. So that's the purpose of it. It is alkaline. So what it does, it neutralizes the acidic environment of the vagina, And therefore, when it does that, it protects the sperm from destruction, because the vagina is made up naturally of substances that's outfitted to destroy the sperm. So that prostatic specific antigen, that enzyme, helps to make sure that the spermatic fluid, the fluid that is coming out, the semen, and so on, once it reaches into the vagina, it neutralizes the environment and the sperm can be transferred safely up to where they can find eggs. The other function of the prostate gland is that it contracts during ejaculation and prevents the urine and the sperm from mixing. And that happens because it's the same passage, that's the urethra, that the urine has to come out of. That's the same passage that the semen has to come out of. So it's going to be passing in the urethra. But the prostate gland prevents the both of them from passing at the same time and therefore from mixing. So that's another important function of the prostate gland. One of the other important functions is that it produces an enzyme called 5-alpha reductase. And that enzyme is the enzyme that converts testosterone, which is the male hormone, into a biologically active form. And that form is called dihydrotestosterone, DHA, DHT. What does that hormone for? That hormone is important for normal prostate development and functioning. So in the male, as they reach puberty and they start to grow, it is crucial, that hormone is crucial for the development of secondary sex characteristics, such as facial hair and deepening voice and muscles, etc. So DHT is important, and that DHT is converted into that particular hormone by the enzyme that is produced by the prostate gland, the 5-alpha reductase. So we saw some of the functions and we see how important the prostate gland is. Some people feel that it is probably a little bit more than that, but that's the functions. What is the condition that we're going to talk about now, which is benign prostatic hyperplasia, also known as enlarged prostate, also known as benign prostatic hypertrophy. So we'll refer to it as BPH to shorten it. So BPH is a non-cancerous enlargement of the prostate gland. So it gets large, but it's not cancer. It occurs as men age. As they get older, the prostate tends to get larger. But when it becomes larger, what it does, it squeezes on the tube, which is the urethra, that is bringing the urine from the bladder to the outside. It squeezes on it and it causes the man to have urinary problems or urinary issues, some of which we will discuss in a little while. So why do men get benign prostatic hyperplasia or BPH? What are the risk factors? How would one man get it and another man would not? Well, studies have been done and they have found that BPH is more common in Black men. They have also found that BPH occurs generally in men over 50 years old. So young men would not have BPH. As the man gets older, the prostate starts to enlarge. And the symptoms related to BPH are present in 1 in 4 men by ages 55. and in half the amount of men of ages 75 and older. So as they get older, more men tend to develop BPH or enlarged prostate. These are some of the other risk factors that put you at risk for developing BPH. Men who have medical conditions such as obesity, which is being excessively overweight, heart and circulatory diseases, and type 2 diabetes. You also have, if you lack physical exercise or you don't do much exercise, you are also at risk for developing BPH. Men who have erectile dysfunction, meaning that they can't, the penis cannot get hard, then it means that they are also at risk for developing BPH or benign prostatic hyperplasia. So those are most of the risk factors, what puts you at risk. Age being the major one. These are some of the signs now of prostate enlargement. And I put it in picture form because it is so much easier to understand. So one on top says that some of the signs, one of the signs is interruption in the urinary stream. So you will be passing urine and then in between you stop and squirts, goes again, stops, squirts again. So that is interruption of the urinary stream. You are not able to empty the bladder completely in one go. Another sign would be frequent urination, especially in the night. So you're getting up often in the night to pass urine. Many times when this is happening, some people may feel that it is diabetes, because that is also a sign of diabetes. Frequent urination, especially at night. Another one is hesitation before beginning to urinate. So you go to pass urine, you want to pass urine, and the urine is not coming. You stand up there and it's like you're waiting for this urine to come, right? Every time I think about that symptom, I think vividly of a gentleman that I saw one day, some years ago. I was driving into the street where I live, and I saw this gentleman stand by the neighbor's fence trying to pass urine. And he is just standing there, and the urine would not come. And he's shaking and shaking and shaking, and the urine would not come. And I said to him, when he was an older gentleman, so I realized one time that person probably had benign prostatic hypertrophy or hyperplasia. So hesitation before beginning to urinate. Another symptom would be feeling that the bladder is still full after you have passed urine. You still have the sensation that you want to pass urine. The ones below tell us 3 other symptoms. Terminal dribbling. So meaning that you have passed the urine has come out of the bladder, but you are still having drops of urine coming out. Then you have an urgent need to urinate. So you would feel that you must reach to the toilet quickly, and you go running to the toilet, and then when you reach there, it doesn't seem like the urine wants to come out. Another sign is weak urinary stream. So you will be passing urine and it is not getting into the toilet bowl as it should. It is going at your feet, right? So as young men, if you remember, as young men, I have 3 adult male children. So I could tell you what I have seen, that when they are younger and they go to pass urine, sometimes they hustle, they reach into the toilet, and they don't have time to project the penis properly. So the urine hits the toilet seat, right? Or even out of the wall, and it is coming out with such force. But as you get older, that stream now becomes very weak, And instead of hitting and reaching in the toilet bowl, it starts to go at your feet, right? And you get all the toilet seat wet and so. So those are signs of prostate enlargement. You see some of the same signs here, just different pictures. The only thing different here would be that you may have urinary tract infections often, right? So all of them say the same thing: difficulty starting urination, urgency to urinate, inability to completely empty the bladder, dribbling at the end of urination, weak stream, right? Frequent urination, urination at night. So those are the signs. And what causes those symptoms to occur? Most of the time, the signs occur because the urethra has been obstructed. That tube is obstructed, that tube that is coming down from the bladder, the urethra is obstructed by the enlarged prostate. So because the prostate is pressing on the tube, then you have difficulty starting to urinate, and that may happen despite trying to push and strain. And you would even hear some men grunting when they're trying to pass the urine because they're trying to force it out and it's not coming out. A weak stream of urine, several interruptions, again, dribbling at the end of urination. So those are basically the symptoms of benign prostatic hypertrophy. And same thing, just repeated, the sensation that the bladder is not empty after urination is complete, frequent awakening at the night. Right. So how is BPH diagnosed? Well, I put the one on top that you fear the most, which is the digital rectal examination. So when a doctor does the digital rectal examination, they insert their finger up through the rectum, and that is the easiest way to feel the prostate gland, because the prostate gland is right next, as the picture is showing, it's right next to the rectum. And when it becomes enlarged, it is actually pressing onto the rectum. So it is easy for a clinician to be able to feel and see if the prostate is enlarged and how it actually feels. Is it smooth? Is it bumpy? That's what they're looking for when they are checking, when they are doing a digital rectal examination. If they do a urine test, the urine test helps to rule out if you have any infections, because their infections can also cause the prostate to be sensitive and have some of those same symptoms that we talked about. Okay, so when they do the urine test, that's to rule out if you have an infection of the bladder. Or sometimes people get an infection of the prostate, and that will also seep into the urine, and you will be able to tell if there is some infection. When you do a blood test as well, the blood test will be able to tell you if you have an infection. The blood test will be able to also indicate if you have any kidney problems, and because kidney problems can also produce some of those symptoms that we're talking about. You will do a blood test for the PSA to check to see the levels of the PSA. Levels of the PSA, once they start to become a little elevated, and when I say elevated, usually the normal would be between 0 to 4. And if it's beyond that, you know that something is going on with the prostate. It might be an infection, it might be enlargement, it might be prostate cancer. But that test checks for that enzyme, that antigen that is produced by the prostate. You can also do what is known as a transrectal ultrasound. So this one is showing that they're using the ultrasound to go in through the penis, right? I didn't find a picture to show the one where they they insert the instrument used to do the ultrasound, they insert it via the rectum, and therefore they could see on the ultrasound screen, they would be able to see if the prostate is enlarged. So it's called a transrectal ultrasound. And again, it's inserted into your rectum to measure and evaluate the size of the prostate. So those are ways to diagnose if you have benign prostatic hyperplasia or hypertrophy. You can also do these other tests. Urinary flow tests, post-void residual. So after you have passed urine, you're looking to see if any urine is coming out, how much it's coming out. 24-hour void in diary. So you keep count of how much urine that you have passed and how often you have passed for 24 hours. And cystoscopy is where they use an instrument as well, and they go up via the penis and they are checking the bladder to see if anything is wrong with the bladder. So all these tests are done to eliminate and determine exactly what is the problem. Is it the prostate, or is it the kidney, or is it some other organ? Is it benign prostatic hyperplasia? Is it cancer of the prostate? Right? So those are the tests that are usually done to determine what is wrong. Then I just want to look at what are the complications or things that can happen to you if you have BPH. These are some of the things that can happen. And all of them basically happen because of the enlargement and the pressing on that urethra or tube that is bringing the urine out. Okay, so you can have what is known as acute urinary retention, meaning that urine stays up in the bladder, as seen in the picture there. So instead of the urine coming out, it stays up there, some stays there. And when urine stays there, the bladder doesn't empty. You can get infections, you can get severe pain in the abdomen, right? And you can get what we call stasis. You can get bladder stones. You can get all of those things can happen if a lot of urine stays in there and it is not emptying completely. So you can get acute urinary retention. You could get chronic or long-lasting urinary retention, and that happens to some men. You can get blood in the urine. You can get urinary tract infections, right? So when they say urinary tract infections, it means the whole tract now, the whole of the urethra gets infected, and you have spasms and so on, and severe pain when you're trying to pass urine. You can have damage to the bladder because the bladder is not emptying, so urine stays there, and you can have the stale urine now causing damage to the bladder. You can have kidney damage because everything can back up and go back up to the kidney, and you can have infections and so on of the kidney, and as I said, bladder stones, right? So you can have all of these happening if you have BPH and it is not treated. And I just want to mention, before I even talk about this other slide, I just want to mention that issues of the prostate, especially BPH and prostate cancer, seems to be one of the conditions that's plaguing our men in Trinidad and Tobago. And this is not now, this is years. When I just finished completing my training as a nurse in 1984, the first ward I was sent to work was a male surgical ward. And I tell you, every week, there was one day in the week where we had, instead of the men going to the clinic to have their catheters changed, they came to the ward to have it changed. And the lines were long. I'm talking about 1984, and it is still like that today. They don't do it on the wards anymore. They may do it in the clinic or wherever it is they do them. But there are a lot of men in Trinidad today. I can't tell you the numbers. And we're talking about in every hospital and clinic that deals with urinary issues for men, most of the time they are there changing catheters. And it can be very traumatic for some men. Why? Because they have been the catheter so long that the urine, when it's coming out and it's there for a little while and whatnot, it becomes like stone, like cement. And when they are trying to get that catheter out, right, you hear the screaming and it is, I'm telling you, it is a really horrific scene, right? And then there are a lot of men who, because they have problems with the prostate and they have to put in the tube that I'm going to show you, that sometimes you have a lot of men, you may not know it, you may not see it. Some of them walk around holding their urine bags, some of them don't. So some of them have the bags inside of their pants, strapped to their leg and whatever it is. And they have these catheters in for years, right? So this is one of the complications of dealing with benign prostatic hyperplasia. If the urine cannot pass through the penis to come out, the urethra, then it means that they would have to put in a tube, either up through the penis to get to the bladder, or they would have to do what is seen here, which is a suprapubic catheter. So they put it into the bladder, but from the abdomen. And as I was saying, there are a lot of men in Trinidad and Tobago walking around with their catheters. Some in suit and tie. They're going to work and it is there strapped to their leg, etc. It's like an epidemic in Trinidad and Tobago. Benign prostatic hyperplasia. How is it treated? Well, some persons have to take medication. Some of them take medication. And these are some of the medication that they take. And that medication, what does it do? It helps to relax the neck of the bladder. It relaxes the muscles and the muscle fibers in the prostate, and it makes passing urine a lot easier. So these are some of the names of the medication, right? Some, I think the most familiar one in this list may be Flomax or Uraxel, right? But Flomax, you hear a lot about Flomax. And these are medication that they call alpha blockers. What they do is that they tend to relax the bladder, the muscles in the bladder, and allow the urine to come out. And they tend to work quickly in men with relatively small prostates. They may have enlargement, but it may not be so large. So these medication or alpha blockers, they tend to work well for that. Some of the side effects, because most medications have side effects. So some of the side effects would include dizziness and, they're saying that it is a harmless condition, but it is not so harmless, it's painful. When the semen goes back into the bladder instead of coming out of the penis. So it's called retrograde ejaculation. So you may have an ejaculation and instead of it coming out of the penis, it goes back up into the bladder. And that can cause infections of the bladder and so. This is another type of tablet medication that they use, and what this one does, 5-alpha reductase inhibitors, they shrink the prostate and preventing hormonal changes that causes the prostate to grow. And the other one that is very familiar here is the Avodat, right? So that one You tend to hear a lot of men who are on these medications. That's another common one, right? So it may take, as it says here, it may take up to 6 months to be effective. And again, side effects include retrograde ejaculation. Ejaculation, sperm, semen going back up into the bladder. This is another treatment that they use. And again, because of the numbers of men who suffer from BPH in Trinidad and Tobago, this is a surgery with a long waiting list, right? So this is minimally invasive surgery, meaning that they don't have to cut anywhere. What they do is the doctor inserts this scope, right, up through the penis, past the urethra, right up until it reaches the prostate. They look into the bladder to make sure everything is okay, and they start shaving off, right? So if you look at the picture down below, you will see bit by bit, they start to shave off parts of the prostate until they shave off almost all. They don't take off all of the prostate. And that helps to reduce the size and therefore reduce the pressure on the bladder. So that surgery is known as transurethral resection of the prostate, or TURP. It helps to relieve some of the symptoms very quickly. The patient very rarely has to stay more than 24 hours to 48 hours in hospital. And what they do while they are there, they have to be flushing out the bladder with normal saline, so it washes out the bladder and so on, and until it comes out clear, and then the patient is allowed to go home, right? Right, so it says here, after TURP, you might temporarily need a catheter to drain your urine. So sometimes they go home for with a catheter just for a little while. So that's a minimally invasive procedure, and there are others. This is the most common one. There are new up-to-date versions of them now, where they're using laser and all sorts of other things that they would use. But again, there's a very long waiting list for men waiting for that treatment. So I decided to put in some other remedies, herbal remedies, natural remedies for BPH, because I know that as men, you all are very much into these things now, especially Adventist men. So I said, let me put in some information there, and you will see that some of them you already know, some might be not familiar to you. So there's saw palmetto, there's pygidium, there's rye, grass, pollen extract, stinging nettle root. I know that you have heard that stinging nettle good for the prostate, pumpkin seed, you always hear about that, green tea, turmeric root, or cumin, and Kegel exercises. So I'll tell you a little bit about all of them. And I think I also added in there lycopene. So you didn't see lycopene on that list, but I also included that. So this palmetto, and show you a picture of what the plant looks like. And I also put in there showing you that it's available. I'm not advertising the brand, right? I'm just showing you that it comes in capsule form. The extract from palmetto has been used for centuries to relieve the symptoms of prostate enlargement. It's derived from a fan-shaped plant that is native to North America. And the experts consider palmetto as a gold standard for herbal prostate treatment. So it has been around for a long time, and a lot of people know it and know that it works well. Right? Another one is pygidium. And it comes from the bark of the African plum tree and has been used traditionally for urinary problems. Researchers have done some research on it, and they believe that it helps the prostate in three ways. One, it directly reduces the inflammation of the prostate. So if the prostate is inflamed, it helps to relieve that. It suppresses the prostate growth factors. And third, it reduces prolactin levels and thereby decreases the uptake of testosterone. So prolactin is another hormone that is produced. A lot of people feel that it is just found in females, and that it's the hormone in females that causes the female after having a baby to produce milk, prolactin, right? But apparently it's also in men, and the levels can go up when you have benign prostatic hypertrophy. So it helps to reduce those prolactin levels and decreases the uptake of testosterone. This is the stinger nettle, right? So we know the plant, we know what it looks like. It's also been packaged in capsules as well. And what it does, it inhibits the enzyme, the 5-alpha reductase. And this enzyme converts the testosterone into dihydrotestosterone, DHT, and that is a potent androgen hormone associated with prostate enlargement. It's also associated with low testosterone levels in older men and hair loss. So this one, the stinger nettle, right? So it's the hormone that it produces as well, that helps, the enzyme that helps to convert to the testosterone. Stinger nettle. I think I've heard that some men use it and they boil it and drink it. Then we have pumpkin seed. Well, that's another well-known one. Sometimes you see the men enjoying their pumpkin seed just as it is, right? Like if it's nuts, it is commonly used to strengthen the prostate gland and promotes healthy hormone function in men. And it's said that consuming pumpkin seeds may help with benign prostatic hyperplasia. Men can benefit from the zinc found in the pumpkin seeds and reduce sperm quality, and even infertility in men may be associated with low zinc levels, right? Because zinc is also one of the substances needed for the production of the prostatic fluid. Then you have turmeric or curcumin, and we know that turmeric is used quite frequently. First, it was known in the Indian population to put in the curry and whatnot, and now it's being used quite a bit among the men, and I think it's being used by everybody because it seems to have good properties. So Movida, which is also one of the substances that is used, it's when it's the turmeric, when it's combined, right? So it's a special formulation of the turmeric designed to increase the absorption in the body, and is helpful in treating symptoms of benign prostatic enlargement without causing side effects. And what I found is, it said that 24 weeks of treatment with this substance improve the quality of life and reduce episodes of urinary infections in patients. So that was a study that was done. Then I put in lycopene, because we have heard about lycopene for years now. And lycopene is, they say it inhibits the progression and reduces the symptoms of BPH. And higher dietary and circulating lycopene concentrations in your body are associated with reduced risk of prostate cancer and may help protect from the aggressiveness of it. So lycopene is important, and I have always heard that it's not just when you're eating the tomatoes just so, but when it's cooked and so on, it releases the products that are needed. And the other one I had here is doing Kegel exercises. And what is Kegel exercises? It is when you are able to clench the bladder and strengthen the muscles there in the pelvic floor. So it helps in strengthening those muscles, and it would mainly involve clenching your bladder for a few seconds as if you are trying to stop the urine flow and then releasing the clench. So men with prostate enlargement and incontinence is when you're passing urine and you have no control over it, they benefit from Kegel exercises as they help in managing the urinary tract symptoms. So I just put in an extra bit of information about how to do the Kegel exercises for men. So first you must find the muscles in your pelvic floor. So you have to do so, you have to start urinating, and after a few seconds, stop midstream. So that way you'll be able to identify the muscles that are at the floor of your pelvic area that is controlling the bladder and the flow of the urine out. So you concentrate on the muscles that you just use, and those, because those are your pelvic floor muscles, and you begin your Kegel exercises with an empty bladder. So you empty your bladder, you determine where the pelvic muscles are. You lie on the floor with your knees bent and apart, and you tighten your pelvic floor muscles for 3 seconds, then release them for 3 seconds, and repeat for a few times. Be sure to focus only on the pelvic floor muscles. Soon you will be able to do this while sitting or standing. Right? So Kegel muscles, Kegel exercises seem to help with strengthening the urethra and so on. All right, so these are some simple steps to get your BPH under control. So one, watch what you drink. So depending on if you drink things like beers and whatnot, or too much fluid and so on, you try to limit the amount. Yes, we want to drink a lot of water, but if you have problems with controlling your bladder because of prostate problems, then you have to watch what you drink. Urinate before you feel the need. So that's another suggestion. Before you feel, so in other words, if you know that you don't wait until your bladder is full and you feel to pee, right? You go before you get that sensation. And that way you can empty your bladder properly. Exercise your bladder muscles, right? Like what we talked about here. Follow a prostate-friendly diet. Avoid some medications. So there are some medications that would irritate the prostate, and we're talking, and the bladder, right? So we're talking about medications that for cold and allergy things, because what they do is cause you to feel to pass urine. Diuretics, those would affect the kidney and so on, and of course they call them water tablets, cause you to pass plenty urine, right? And one of the other things is to reduce your stress levels. Reduce your stress level. And some of you may be saying, how are we doing that? You need to relax. You need to do relaxing things. You need to exercise. All those things help to reduce stress. And the 7th one says, know when to go to the doctor. So you don't wait and say it will get better eventually, right? You know, you sense it that you're having a problem, you're having an issue. Don't be macho about it. Find yourself by the doctor. Okay, so now we're going on to, so instead of stopping for questions, I'll do both conditions one time, right? And then you could get all the questions after. So we're looking now at andropause. And you may have heard of it. Some people say they never heard of it, right? What is andropause? Well, some people refer to it as male menopause, right? But the term for it is andropause. Andropause. It describes age-related changes in male hormone levels. So just like in the female you have changes in the female hormone, the estrogen and the progesterone. In the male, you have changes in the testosterone. So the male menopause involves a drop or lowering in the level of the testosterone that is produced in men who are age 50 and older. One of the things about andropause, and I think I have it on the next slide, it does not happen to all men, right? It does not happen to all men. It will happen to some men. What does testosterone do in men? So I'm reminding you, because you know most of you online are men now. Testosterone is that hormone that is produced in the testes of the men, the seeds, the balls, right? That's the testosterone, is the male hormone, and it does more than just fuel a man's sex drive. It's also responsible for the changes that occur during puberty. So as a young man goes into puberty at whatever age, whether it be 12, 13, 14, right? They start to have changes in their body. So they get more muscular, they get more, their voice deepens, the sexual organs grow. So you have the penis growing, the testes growing, and so on. You get hair under your arm, you get hair, you know, beard, you get facial hair, you get hair around your genitalia area, right? And the part they like is that muscle mass. So they start to have muscles. They want to have a six-pack, and you know, and the testosterone is also responsible for regulating their fight or flight response, right? So that's when you are under whatever kind of stress, right? And something happens and you want to either fight or you want to run, right? Testosterone is one of those hormones that regulates that fight or flight response. Right? So those are some of the basic. There are others, what testosterone do for men, right? So it's normal for men to experience a decline in the production of the male hormone testosterone as they get older, as they age. But this also occurs in other conditions, such as diabetes. You would have the testosterone level dropping as well. So along with the decline in testosterone, some men also experience symptoms like fatigue. That's men that go into andropause. Tiredness, extreme tiredness, weakness, depression, and sexual problems. So those are some of the main symptoms that men will experience. Fatigue, weakness, depression, sexual problems. Then there are some other symptoms, as I said, right? Some may be male menopause, may cause physical, sexual, and psychological problems. So basically they are the same thing, but they get worse as you get older. So the low energy or the fatigue, you're not able to, you know, stay up long, you're feeling sleepy and whatnot. You have depression easily, sadness, right? Decreased motivation to get up and do anything, to do anything work-related, lowered self-confidence, difficulty concentrating, right? So those are some of the other symptoms. And I put some pictures here for you to see some of the others as well. So it affects the brain, as you see here, with the depression and the cognitive function, turning up the hair and turning up the hair. So you start to get bald and you have hair loss. You have gynecomastia, or you start, you start getting a lot of fat around the breast, right? Reduced muscle mass, right? So you find that instead of having those nice muscles, deltoid muscles, and so on, that the muscle starts to wear away. Increased fat in the abdominal area, loss of elasticity of the skin, so the skin starts to, droop and so on. Testicular atrophy, meaning that the testicles and they start to get smaller, right? Decreased sexual desire, reduced levels of testosterone, and the bone mass. One of the things, just like with the female, the bone mass starts to have reduction in the bone mass, and you start to have osteoporosis and so on, and easy to get a fracture. So those are some of the symptoms and complications of some more, right? And some we talked about already. I just named them, right? Decreased bone density, erectile dysfunction, reduced libido, infertility, right? And all that because of the lower levels of the testosterone, right? Insomnia, difficulty to sleep, right? Reduced muscle mass, feelings of physical weakness, right? So those are all because the levels of the testosterone are falling. How is it diagnosed? How do they determine that you may have andropause? So to make the diagnosis, what the doctor will do, he has to do a complete physical examination, and he will ask questions to determine if you are having any of the symptoms that I indicated before. And in order to rule out medical problems like diabetes or so, because some of the symptoms are similar, they do several blood tests, right? So they would order blood tests, and one of the blood tests would be checking to see what is the level of the testosterone in the blood. Once they determine that it may be andropause that you are going through, then there are several things they do to manage it. One may be that they would give replacement testosterone, right? So they give it in the form of tablets, injections, just like with the female when they're trying to replace, when they do hormone replacement therapy, gels, etc. Right? So those, you have testosterone in that, and some people may choose to take that to help with the symptoms that they're feeling. Now, most of the times that they would give that is if they have a condition known as low T, right? So there are some men who, they may not be in andropause, but they start having lower levels of testosterone. And that is how it is treated, by giving these supplements and so on, but via gels, injection, tablet form, and so on, okay? So most of the time, if they determine that it is andropause, and that is because it's life happening to you, then they may hardly suggest giving replacement testosterone, but to do other things. So some of the things that is suggested would be lifestyle changes, such as increasing your exercise, reducing the stress, and having good nutrition, right? A well-balanced diet with foods that are, as we said, prostate healthy, right? So exercise should be very effective against andropause. as it is often related to depression. Exercises that are helpful in improving the mood can be very effective. They can also make you feel better, as it would boost the level of endorphins in your body. So when you exercise, those levels of endorphins go up, make you feel good. Therefore, if you think you are experiencing andropause, make sure to make exercising a habit. You can also engage in various sports like tennis, basketball, and, you know, all those things that that you used to like when you were younger. You can try to continue to engage with them as you get older still. Walking, etc., running, and, you know. Another one would be following a healthy diet. It's helpful against the symptoms of andropause. Take note that certain foods have positive impact on the mood and the energy, and your diet should include large amounts of vitamin D, folic acid, vitamin B12, omega-3, right? And I put in some pictures of some foods that they say are testosterone-rich foods. And I'm sure that you love them, the broccoli and the bananas, all the nuts and grains and so on. As it says, salmon, almond, flaxseed, B12 from eggs, cheese, folic acid, broccoli, oatmeal, whole wheat, vitamin D from milk. So there are so many things here that you may not eat, like cheese or the eggs, right? But there's a lot more that you can certainly utilize, right? Another one is to avoid consuming alcoholic beverages. I know that as Seventh-day Adventist men, you may not be using alcohol, but it's just a reminder, right? So as it says here, as you get older, your bodies react differently on alcohol, and therefore you want to prevent or treat symptoms of menopause. Make sure that you avoid consuming beverages with alcohol in it. Alcohol intake lowers testosterone levels in the blood, and it can also affect your libido and erectile function. So in order to manage symptoms of andropause, or even to prevent it, try avoiding alcohol consumption. Right? And I make sure I put in this. Consume plenty of zinc. It's vital. I mentioned it before in the production of testosterone. And it's always a good idea to consume recommended daily amounts of the mineral. Insufficient consumption contributes to low testosterone, and therefore that would affect sperm production. So you have the listing there of the zinc-rich foods, pumpkin seed, well, it has beef there, chickpeas, which we use a lot of, cocoa powder, cashews, yogurt, kefir, mushrooms, spinach, right? So those are some of the things that have zinc in it, and therefore you are encouraged to utilize plenty of zinc. Due to the importance of the mineral for testosterone production, many supplements contain zinc already in their formula. So you just need to look at your labels and see. You also want to avoid estrogen-like compounds. As you know, estrogen is a female hormone, but some men have some levels of estrogen as well. And therefore, if you utilize or you eat products that are estrogen-like, then you are carrying up the levels of estrogen in your bloodstream, and they are antagonists for testosterone. Okay, so you want to stay away from estrogen-like products. And one of the estrogen-like products that we know, phytoestrogens, we have phytoestrogens, and soy is one of those. So if you know you are experiencing symptoms of andropause, then it is suggested that you stay away from soy products because it is a phytoestrogen, right? So and it can affect the testosterone levels and decrease even more their production. So this is the end of my presentation, and I leave you with saying, I finish by saying that you are in your prime. Even though you may tell yourself, I'm getting older every day, but you are still in your prime. It starts from the brain, from the mind. You are what you think you are. Okay? So this is it. So let me take down my.
Thank you.
You're most welcome. So we have lots of times for questions because I'm now seeing Brother Hughes said that you'll expect to finish by 8 o'clock and it is 7:30. So we have time for questions.
Is there anyone?
Or
Right.
comments?
Yeah. Well, I have a question. Yes?
Yes.
Right. I understand that the root of the shadow Benny is quite useful for reduction of prostate or prostate problems, let's say. What is your what are your thoughts on that?
Well, I have heard of a lot of herbs, but I have not heard of shadow burning, right? But it's just something that we use quite a lot of in Trinidad and Tobago. We put it in almost, I know I put it in almost everything that I cook. So, you know, I don't think it is harmful in any way. As you're talking about shadow burning, some of the other herbs that I have heard of, things like soursop, right? A lot of actual studies. I know at the University of the West Indies, they started to do some studies into with the soursop bush and the leaves and the, all other parts of it, so that they could see, because apparently they are saying that something is happening good with the, but it is mainly related to prostate cancer, right? But there are so many other of our herbs that we have locally that people have started to use, and they seem to feel that they're having good results with it.
I have two questions.
Yes,
You
sir.
hear me?
Yes, I'm hearing you clearly.
The first question is, at what age this BPH really starts? What
Anytime
age?
after 40. From the
After
time you
40.
start to, yeah, from the time you start to, well, at least with black men. So because black men seem to have a little more challenge, let me put it like that, and it has to do with your genetics. So they have a little bit more challenge with developing benign prostatic hyperplasia, right? So we're talking about after their 40s, into their 50s, and as they get older, then you are more at risk for having an enlarged prostate.
And what is the percentage of men with BPH who end up having prostate cancer?
Well, I certainly don't have those figures for you, but I can say that there are two different conditions, right? So with the BPH, it means that the prostate is getting larger, but it is not cancerous. The cells are not cancerous. And there is a percentage in all benign growths, let me put it like that, benign growths, but we have several. So there are a percentage of those growths that can become cancerous. right? But you can have BPH without having prostate cancer. It doesn't mean that if you have BPH that you will get prostate cancer.
Third question.
Mhm.
What are the effects of removing prostate gland altogether if it is cancerous? What is the effect? What effect it has on the patient?
No effect.
No
No
effect.
effect. I know that a lot of people feel that if they take out the prostate gland, that you know, they can have problems with having an erection and that kind of thing, right? And I would say to you that that probably used to happen years and years before we were even born. Because years ago, when they removed the prostate, they would damage the nerves. And it's these nerves that would give you the erection and that kind of thing, right? But now, if they have to remove the prostate, what they do is nerve sparing surgeries, right? So they would avoid damaging the nerves, and therefore persons would still be able to get erections and so on. And to them, well, I shouldn't say to them, but I understand for the male that is a very important thing to be able to still maintain an erection all in their 80s, etc. Right? So the surgeries that are done to remove the prostate, because as I did with some reading today, the statement said the prostate is it is important yet, but the things that it is important for are the things that I would have listed, right? The prostate gland helps to produce it's part of the seminal fluid, right? So what makes up the semen and all of that. And what else in the semen is there is what can cause somebody to become pregnant, right? Which is the sperm, okay? So the prostate, all the functions that I gave you about the prostate gland itself, it doesn't have to do with you, you know, with you being fertile. It helps with the sperm being fertile, but it certainly does not cause you to have an erection. Other things cause the erection. So the structure of the penis, with the blood flowing in and not flowing back out, that is what causes the erection. And the nerves, okay? So not the prostate gland necessarily. I hope I was clear.
Yeah. I remember as a youth, the older men used to suffer from stoppage of water. I remember hearing that word. Stoppage of water. The same thing.
Stoppage of water. So they can't pass the urine, right? And that's what they call stoppage of water.
All right, thank you very much.
You're welcome. I'm seeing Glenda Warren. I see your hand up.
Good afternoon.
Well, good
Are you
evening.
hearing me?
Yes, I'm hearing you clearly. Go ahead.
Okay, you stated that from 0 to 4 is the normal level of enlargement, you know, where the prostrate should be.
PSA.
0 to 4.
The PSA. PSA
Okay.
is the blood test that tells you, yes, right. So 0 to 4
therefore,
is normal.
if you are observing enlargement, up to what level? I don't know how to talk to this, because I'm really discussing about this pH business. Up to what level can you say it is in danger?
Okay,
like if it reached the 17, you know?
Okay, now in increased levels of the PSA, which is the antigen, right? Which is, let me just put it like this, a substance that is produced by the prostate gland, right? So that PSA or antigen is important for nourishing producing the substances that nourish the sperm. Okay, now when you have increased levels of that product in the bloodstream, it tells you several things. It tells you that the person may have an infection, right? An infection of the prostate gland, right? Or an infection of the bladder or something like that. It also tells you that the person may have cancer of the prostate. It does not indicate that you have enlarged prostate. So that infection and prostate cancer. So when the levels start to rise, you can say, the doctor will say, let's do further testing, because they are trying to determine if it is an infection that you have, an infection that the man has, an infection of the prostate, or if it is prostate cancer. When the levels start to get very high, like all 5, 6, 7, 8 going up, right? Then you know that it may definitely be prostate cancer, so they start doing other tests. They may take a sample, do a biopsy, check it in the lab to see if it is prostate cancer. Right? And it also, the levels of the prostatic, the PSA, also tells you if you had cancer and they got treatment, if it is coming back or if it has gone away. So when it has nice low levels like 0.01 and 1 and whatnot, you know that your cancer is under control.
But if you should do a test.
No, the test wouldn't say benign.
It's like swollen to the left side, benign, okay. Something like that.
All right, so if it says, if they do a test, most times what you're talking about would be like if they try to do an ultrasound, that would tell you swollen to whatever side and whatnot, right? So that indicates that it is swollen and enlarged. Now the swelling could either be infection, or it could be that the prostate is enlarged, it's swollen. Right? You could have an infection, they call it prostatitis, an infection of the prostate itself.
Okay.
Right, so you sound like somebody concerning you had some results like that, right? But I'm sure that they would say that more testing has to be done, right? And just large prostate is not cancerous. The main things that can happen are the complications or the side effects. So if it is not dealt with, it can get larger, it could damage the bladder, right? So that becomes a complication. It becomes very problematic. It can have, because the urine backing up, it could back right up to the kidney and damage the kidney, right? Those are the things that can happen when you have untreated benign prostatic hyperplasia.
But sister, if you are using the different things like what you call there, the stingonettle and whatnot, that should help. But that help?
But it wouldn't happen. It doesn't happen all the time to everybody, because sometimes, you know, with herbs, one thing about herbs is that people are still uncertain about how much to put, how much to use, right? And how much is more effective than not effective. How much will overdo it, right? So we have to be very careful. We have to be very careful when we are just using things now, right? Sometimes, I know my husband wouldn't like me to say this, but I'm saying it all the same, right? He is very much into herbs. He loves his herbs, right? So you know, they believe in, I say indeed, they believe in mixing herbs, using everything, you boil up everything, because everything good. So they throw in this thing and they throw in the tea, and they throw in the, right? And they mix and they make a tea from it, and they drink everything. But the science hasn't been done to say this is not to react, this is reacting with this and not causing, you know, causing a problem and so on, right? That hasn't been done as yet. I have not seen studies in relation to that. So I always say you have to be careful. You have to be careful. The herbs are there, yes, but you have to be careful in what you do, how you do. We don't know. If you know what is the correct dosage, fine. But when you don't know what is the correct dosage, I do not advocate mixing herbs.
But sister, you must know your husband mix up good.
Well, he is from Tobago, and they are well known for all the crop drinking bush tea, right? All kind of bush tea and whatnot. But you know,
and you know that, right? From
I know that.
experience, right? From
Yeah, but
experience,
that doesn't mean
you must
that.
know.
No, you know why I say that, and I'm saying again, I'm not to say that I don't like herbs. I'm not saying that I utilize them too myself, but I try to be very cautious, right? I know somebody, let me put it this way, I know somebody who died from a condition called cirrhosis of the liver. That is when the liver is completely broken down and damaged and so on. And usually it happens with people who are alcoholic, right? And that person died, and the doctor asked if she was an alcoholic. And we said no, she did not drink alcohol. The next question he asked, did she use a lot of bush tea? Because what he said is that the bush can damage the liver, right? Especially when we don't know how to mix and match, right? And he was from Tobago too, the doctor, let me say that, was from Tobago too, and grew up drinking bush. And as much as I may want to drink this and that and whatever it is, I don't believe in mixing. I've seen it cause damage, right? So I'm seeing other hands.
Good night, sister.
Yes, good night.
Knowing the properties in certain herbs and even plant food, wouldn't you recommend, well, that, you know, as you were saying, herbs, we would say, could you recommend a safe amount for people to use for certain ailments?
I'm not a herbalist, so I cannot say, you know, this amount, use 5 leaves in this, 2 leaves of that, whatever it is. It's definitely not my specialty. So I would not and cannot recommend. I could tell you that you can, you know, persons who are very much interested in that, there are books available. There are persons who sell herbs and whatnot, have their herbal place and whatnot. They might be able to give you recommendations as to how much and that kind of thing, right? But that's not my area of expertise.
Sister Tobias, Thomas Houston.
Yes.
Good evening. On the last occasion, you spoke with us concerning the area with respect to women, that is menopause and breast cancer.
Yeah.
And I would have observed I would have observed the number of participants were much greater then than now. And that tells me one thing, that men, they are not too concerned, I would say, about probably their health, or
Mhm.
they feel that we are good. We don't have to do this, that, or the other. But the thing is, when it's too late, then we come to the doctors and the herbalists, and we want to try this and try the other. But now we are
That's
getting
right.
information as to what should be done, how it can be curbed, why it happens, what you can do to minimize the effect, cause and effect. With respect to this scenario, what counsel or what advice would you tell us as men, to those of us who are, I would say in inverted commas, hard-headed?
Well, the only thing I could say is, sometimes they need to hear the message over and over and over again, right? Before they listen. And, what you are saying is so right. 2 days ago, I was in a session again and it was geared to men, young men and older men. And when I looked at the amount of persons on it, it was 16 persons. And I know that the persons who were trying to, spark something would have been saddened by that. But it is something that is years. It is years that I have been, talking and trying to educate. And like for me in my church, when I always say a prophet in his own place is not recognized, right? And several times I would have done talks for the men of my church, and I started counting. How many men over the years have come down with prostate cancer in our church. And I'm not even talking about those who have enlarged prostate, because they have plenty of those, right? We have had, when I count over the last 20 years, we have had probably about 6 men dying from prostate cancer. This year alone, we had about 4 persons diagnosed, and I think probably 3 persons died from prostate cancer.
Hello, good
Trinidad
evening.
and Tobago. Yes, I take your comment just now. Trinidad and Tobago, I didn't mention because I wasn't talking about prostate cancer, but Trinidad and Tobago is fourth in the world for prostate cancer. Fourth. It is terrible. It's like an epidemic in Trinidad and Tobago. And why? They have a lot of men in the States.
I want to cut you across here.
Yes.
It is not easy to take that test. It is not easy to take that. That test does not be easy at all. So
which test you're talking about? Which test? The digital rectal examination?
Yes.
Hello. Let me tell you something. I'm sorry. I have to get online for this. When a woman has to go for a vaginal examination, when she's having a child and whatnot, it's not a finger going up, it's a hand. It's a hand.
Sister.
Yes, brother.
Somehow that is an entrance, not an exit.
What? Hello. When you think about what can happen when you don't go and check yourself and whatever it is, that's supposed to put a stop to you and say, hey, because a lot of men, when they eventually do one, they say, but yeah, this thing wasn't so bad enough. It's just because I hear people talking about it, it wasn't so bad after all. Right? And it is not men alone have to have digital rectal. They do digital rectal on women too. I had one already because I had some bleeding and whatnot, and they had to do a digital rectal. Yes, it's uncomfortable. It's not, nobody said not uncomfortable, but other than that, it helps to find out what is going on.
All right. Sister Tobias, our
Yes,
time is
sir.
fast spent. And I know there are a number of questions, even though we did not get the number of attendants we would have liked.
Yes, I'm still seeing like 3 hands up.
I will take 2 very short questions after I ask this question. I will make the statement and ask this question. With respect to the andropause, you mentioned reduced libido, reduced testosterone level, and reduced sexual desires. As a wife, I'm going to put you in a position there. From where I stand or sit, whichever you would take it at. What counsel or advice would you give a wife with respect to that particular?
The same that I would give and that I gave the woman, right? Like when I spoke to the woman, patience. Patience. Where there's love, right? There's patience. There should be patience. So I would say that a wife should be understanding once they have the information and they realize, well, okay, it's not, it's the, as we age, these things are happening, and therefore let me be patient, loving and understanding. So that's the advice that I would give.
The frustration level may step in there, sister. I think that may tell a lot.
And the thing about it is that the men tend to be a little bit more, when these things are happening to them, they feel that they must perform, right? And they don't realize, and they become impatient with themselves. And therefore, sometimes the behavior changes and that kind of thing. And so I'm saying that the men also need to chill, understand that, okay, you get to know, so what? Sex is not everything. Love is what it is, right? So therefore, sometimes you just need to put yourself and say, well, okay, this happening again, and the woman, and you have to realize that the woman understands. Sometimes when the woman acting up and so on is in reaction to what they're getting from the men, the behavior that they're getting from the men. So sometimes they just need to, as men, you all just need to carry down the ego a little bit. Carry down the ego and realize that your wife still loves you no matter what, right?
All right. Good evening, Sister Tobias.
Evening. My hand has been up for the longest while.
One more question after this.
Should I go ahead?
Yes, you can go ahead.
All right. You said about testicular atrophy, that is shrinking of the testicles.
Yes.
Does that affect the penis and its function?
No, it should not. It shouldn't, but usually if they're having testicular atrophy, what would happen too is that the other organs may also be involved, right? Because even as the testicles start to shrink, that has nothing to do with the functioning of the penis, right?
Okay.
But the testosterone is what is going to affect sometimes the enlargement and so on of the the ability of the male then to get an erection, right?
Okay, thank you.
Yeah, you're welcome. There was one person saying that their hand up for a little while. Who was that?
That's me.
And that will be the last,
Right,
and that will be the last question, Sister Tobias. That will be the last question. This person can go ahead. This will be the last question.
Okay, good evening. I just wanted, I don't have a question. I just wanted to make a comment. I must commend you on the way you carried out the program, the way you explained everything. There was not even a need for a question. I must say that is very nice how you do that. But the world we live in now, if we are to follow the 8 laws of health, all these will be banished. incredible nutrition, fresh air, exercise, sunlight. That is one thing. When we look at prostate, and trusting God, lots of water and rest. When we look at a lot of the men who are coming down with those urinal infections and those type of things, a lot of men drive a lot. They sit, they go around during the day, they do not drink the water, they do not go to the bathroom frequently. So you find these things are happening, and we're not obeying the laws of health. Once you're not obeying the laws of health, disease will come upon us. And when it comes to also herbs and how to take the herbs, the best thing that everybody should do is visit a herbalist. And teas and all these things, we just did, okay, we have bush tea in our yard, so we just drink it. There is a limit to everything. And yes, you can overdose yourself. You can kill yourself on taking herbs and taking teas if you do not know the recommended dose that is needed for that. Thank you.
Thank you for that comment. And I must say, because we have books, the Adventist bookstore has books. I have a book on teas. Just as the sister say, I have a book on teas, and in it has dosage. It has how much to take, how long to sip, etc. Right? But
you're recommending it? I just asked you that just now.
yes, I am saying thing. What I said is that the overdoing it. We don't know how much is the dosage of how much stinger nettle, how much whatever it is. But there are places where we could find that information, and that's what the sister was saying, right? There are places that we could find that information. I don't have that information because I am not a herbalist. So, right?
I have one to add to you. Imanze Mari Picker.
Okay, never heard of
the one with where as you touch it, it closes, eh?
Timari.
Timari Picker, yes.
Yeah. Yes.
Very
I'm hearing a lot about that as well.
Yes, it is.
Yeah.
I would like to know if the root of that is good to use.
I now will hand over to our pastor, Pastor Ian Morris.
Okay, good night everyone. It's good to be with you tonight. I mean, it's a lot of information. That's a set of bias that you shared. When I first took notice of the program seriously, even though Ella Hughes spoke to me, and just hold on here. I'm sorry. Yes. So when Elder Hughes, I don't know the device. Yes. So when Elder Hughes spoke to me, I said this was a great program and everything, and I really didn't take notice of your name until recent, until lower down, and then I said to myself, a woman talking about a man's prostate. How is that going to go? You know. So as the program continued, I think I must say that you did a great job, and I really want to thank you and commend you. And I believe there should be time for you to come back again, because these are serious problems. These are serious issues, and issues relating to men are usually not taken seriously. Society doesn't take it seriously. Men, they don't take it seriously. But these issues are very, very important. So I'm happy that you were able to address some of these issues tonight. I want to thank Elder Hughes and the type and the quality of programs that he continued to bring. I want to thank Elder Zion Marquis. I got some of your song, so I want to thank you very much, Zion Marquis, Elder Brother Shade, as he played the keyboard, Elder Mitchell, and everyone who participated in this program. We will continue to have many of these touching issues related to men, touching issues related to women and children and the youth. We are on a path we are dealing with salvation, and spiritual salvation must also include a physical dimension, emotional dimension, mental dimension, because a man who is saved must be saved totally. And so may God continue to bless all of you. May God continue to bless you, Sister Tobias. And I pray that you would continue to be available to educate the men of Trinidad and beyond. I really appreciate all that you did. And I think that all of us could, all those who were listening could say collectively, we are glad that you were able to lecture to us, to minister to us today. You did it down to earth, with a warm personality. I pray that God continues to bless you, bless your husband, bless your family. So may God richly bless all of us. I want to turn it back to Elder Hughes.
Let's have our benediction at this time. Let's pray. May the love of God, may the grace of our Lord and Savior Jesus Christ, and may the fellowship of the Holy Spirit rest and abide with us all. In Jesus' name, amen.
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 Thanks very much, Sister Tobias. Lovely.
Thank you for the informative lecture.
Thomas.
Good night, Pastor Morris. Good to see you after 15 months.
Brother Hughes, a lot of people are asking about local herbs. But Dr. Espinay will be doing a workshop on that, the upper room. So, that's a good thing to tap into.
The date you called is August or September?
August will be that workshop. I think it's this week, and it goes on for